I want to talk now about who will actually get the vaccine first when it's finally rolled out. In New York, Governor Cuomo's preliminary plan breaks down the distribution into 5 phases. At the top are healthcare workers and at-risk nursing home patients. Next come first responders, teachers, essential workers who deal with the public, and people with underlying conditions. Then those over 65 and younger people who are more at risk, followed by essential workers who don't interact with the public, and finally healthy adults and children. All right, so that's the pecking order, so to speak. Doctor, does it make sense to you?
Yes, it absolutely makes sense to me. I think, our primary objective needs to be to take care of those that are really at highest risk of coming in touch with COVID very often, and that would be our healthcare workers in the hospital. We obviously need our healthcare workers to be healthy in order to work and take care of the many patients with COVID in the hospital, so that's very important. And then we talk about our essential workers. Essential workers are really on the front line. They are the people that we don't necessarily think of every day. Sanitation workers, waste management workers, people who handle the transport system. Without them, our society just can't run. So we're always really grateful for their help. And unfortunately, they can't work from home. So they're really putting themselves at risk every single day. And they really need the protection that will help them to prevent COVID. We also know from a lot of data that the essential workers, a good amount of essential workers fall into the underrepresented minority groups. About 30% plus are actually African American. So by targeting, these essential workers, we're also targeting some of these underrepresented populations, which are really high risk of developing COVID and severe COVID complications and death. We know that there's a huge discrepancy in the number of people developing COVID complications within Hispanics, Latino, and African American communities. So really important to target that population to help decrease their complications and improve their quality of life.